Hello, my name is Morgan Callaghan, and I'm going to talk to you about my health behavior campaign on reducing gestational diabetes among pregnant women. So, for an introduction, the health behavior campaign is to reduce gestational diabetes among pregnant women, and I chose this topic because I think providers need to do a better job at educating pregnant women on all the health outcomes that could happen during their pregnancy. And it can be a scary time for pregnant women to be going through so many changes. It can also be a beautiful time. Some women are luckier and do not have as many complications during pregnancy, while some have it harder and go through a lot during this time. And it's important to take care of your body. Being prepared before, during, and after pregnancy can help alleviate some of the stress that comes during this time. It is important for their OBGYNs to educate them on preventative measures that can be taken to help themselves, to help keep themselves healthy and the baby healthy. If doctors do not take the time to educate pregnant women, then poor health outcomes and complications can occur. And then it is known that gestational diabetes can be prevented. It can be prevented through exercise, maintaining weight, and eating right. So for my needs assessment, 2% to 10% of pregnancies in the United States end up having gestational diabetes. And gestational diabetes is a type of diabetes that can develop during pregnancy in women who do not already have diabetes and when the body cannot produce enough insulin during pregnancy. Gestational diabetes usually stops occurring once the pregnancy is over with, but it can turn into type 2 diabetes. About 50% of women with gestational diabetes go on to develop type 2 diabetes, but there are steps that you can take to prevent that. And then it's also important to talk to a doctor before coming pregnant to see the risks. So my campaign goals is to increase knowledge on how to prevent gestational diabetes among women, increase knowledge on how to exercise properly to maintain their weight during pregnancy, show what food should be eaten to fuel the body, and have a healthy baby, and then decrease gestational diabetes among pregnant women, and then have this campaign target pregnant women and women who are wanting to become pregnant. So this can help educate women on the risks for their even pregnant instead of finding out during. So with a review of research, the impact of maternal obesity extends beyond birth, being independently associated with an increased risk of child obesity. So this goes hand in hand with gestational diabetes because if an intervention targets diet and exercise among pregnant women before they are pregnant or during, then it can help decrease the risk of obesity or gestational diabetes. And then gestational diabetes is a potential risk factor of both maternal and fetal complications during pregnancy. So this article that I found with being overweight and obese was greatly associated with developing gestational diabetes. If women were active and ate proper foods, then they would not have as high of a risk of developing gestational diabetes. So this is the reason why this campaign needs to be developed, so women are educated on why they should take care of themselves. So the theoretical model underlying campaign approach that I chose was the health belief model. I think this was the best choice because this health belief model is used to guide health promotion programs and disease prevention programs, and is used to explain and predict individual changes in health behaviors. So this is helpful for my campaign because we are trying to change pregnant women behaviors to want to exercise and eat healthier. And then a main thing with this campaign is the group sessions. And these sessions will help pregnant women be able to talk to other pregnant women about their gestational diabetes or other pregnancy issues. This will help them not feel so alone in this journey and will hopefully change their behaviors to become healthier. So a summary of my campaign strategy is to first create partnerships with local organizations like hospitals, health departments, nonprofit organizations, OBGYN offices, and dietitian offices. Networking and partnering with these organizations will benefit the campaign because the campaign can be advertised at their offices and can be talked about to pregnant women or women who are wanting to become pregnant. And then we would advertise the campaign online and on a website through social media. This way that anyone can look at all these resources at any time and it'll be easily accessible. the organizations that we have partnered with can also repost our information on their sites, and this will help further reach different audiences that way. And then the resources that would be posted on the website and social media would be how to exercise while pregnant, what to eat to fuel your body, group sessions, fun facts about gestational diabetes, and then again, the group sessions would be the main component in the campaign to try and target pregnant women and create a safe, supportive space to be able to talk about their experiences with gestational diabetes or with their pregnancies. And then the group sessions will also offer exercise tips and recipes and will happen once a week. It will also be open to pregnant women who have gestational diabetes and who do not have gestational diabetes. And then lastly, my evaluation strategy would be to have a survey that would happen during group sessions to see how beneficial they were for pregnant women. The survey will gather information on finding out if they do have gestational diabetes and if the campaign helped them while having gestational diabetes, the support that they get through the sessions, ask how well the website provided resources to them, ask for any improvements, and see if the exercise tips and recipes were helpful. This will overall see how well the health campaign is working and what improvements can be made. And then my references. Thank you for listening to my presentation.